Did you know your DNA might help predict your risk of prostate cancer years before symptoms appear? Scientists are now using something called a polygenic risk score, or PSA, to estimate a man's inherited risk of developing prostate cancer. Some researchers say this could transform screening, while others warn it may lead to overdiagnosis and unnecessary treatment. So what's the truth? Today, we're going to break down what a polygenic risk score actually is, why it's getting so much attention, what the latest evidence shows, and whether this could change prostate cancer screening in the future. A polygenic risk score is basically a genetic risk calculator. Instead of looking for one single bad gene, scientists examine hundreds of tiny genetic differences across your DNA. Each one may slightly increase or decrease prostate cancer risk. On their own, these genetic variants don't mean very much, but when combined together, they can estimate whether someone has an average, lower, or much higher than average risk of developing prostate cancer. Think of it like rainfall. One raindrop doesn't cause a flood, but hundreds together can. That's essentially what researchers are measuring with a polygenic risk score. So why does this matter? Right now, prostate cancer screening mainly relies on PSA blood tests. The problem is that PSA testing can sometimes detect cancers that would never actually have caused harm. As a result, some men undergo unnecessary biopsies, anxiety, and treatments that can lead to side effects such as erectile dysfunction or urinary problems. Researchers hope genetic risk scores could help identify which men need earlier screening and which men may not need aggressive testing at all. The idea is personalized screening. Instead of treating everyone the same way, screening could eventually be tailored to a person's genetic risk. One of the biggest recent studies came from the UK and is called BARCODE1. Researchers looked at men with very high genetic risk scores. Even when their PSA levels looked normal, they were offered MRI scans and biopsies. The results surprised many doctors. A large number of these high-risk men actually had prostate cancer, including aggressive cancers that standard PSA screening might have missed. Researchers estimated that many of these cancers would not have been detected using traditional screening methods alone. That's why this study generated so much excitement. It suggests that DNA-based screening could potentially catch important cancers earlier than current approaches. But here's the important catch. These genetic scores are much better at predicting who might get prostate cancer than predicting who will develop dangerous or life-threatening prostate cancer. And that difference matters a lot. Some prostate cancers grow so slowly that they never become life-threatening. Critics worry that widespread genetic screening could increase overdiagnosis by finding more harmless cancers that never needed treatment in the first place. Another concern involves ancestry. Earlier genetic risk scores worked best in men of European ancestry and less well in other populations. Newer studies are improving this, especially for men of African ancestry, who actually face higher prostate cancer mortality rates. But researchers say there is still more work to do. Most experts now believe the future probably won't rely on a single test alone. Instead, doctors may combine genetic risk scores with PSA tests, MRI scans, family history, age, and other risk factors to create a more complete personalized risk model. In the future, this could mean that men at high genetic risk start screening earlier, while lower-risk men avoid unnecessary testing and procedures. That's the direction the science is moving right now. So here's the bottom line. Polygenic risk scores for prostate cancer are promising, and the science is advancing quickly. They may help doctors identify men who would benefit from earlier or more intensive screening, but they are not yet a replacement for current screening methods, and scientists still need proof that these approaches actually reduce deaths and improve long-term outcomes. For now, polygenic risk scores are best viewed as an emerging tool, not a crystal ball. If you found this video helpful, subscribe for more evidence-based health and science explainers. And let me know in the comments, would you want to know your genetic risk for prostate cancer?